Hey guys, it's Phil here, Doctor of Physical Therapy. And today I want to talk about why you need to understand lower back pain sensitivities when we talk about lower back pain. So remember that everything I talk about here is for entertainment purposes only. This is not medical advice. Why do we need to understand lower back pain sensitivities? So understanding your triggers is the first step of getting better. But first we have to lay out the groundworks and give a general overview. Lower back pain is very, very complicated. A quick Google search often leads to some depressing findings. You hear things like stenosis, disc herniations, disc bulges, facet dysfunction, and DDD, disc degenerative disease, which quite honestly sounds scary and often leads to people to believe that they're broken and that they need some fixing. Here are a couple things that I want to acknowledge. Number one, lower back pain is super common. It's been shown that the lifetime recurrence of lower back pain can be as high as 65 to 85%. The majority of people will experience lower back pain at some point in their lives. Number two, most people will have some sort of abnormal findings on imaging. What that means is if you put a ton of people into an MRI scan, you'll most likely see some type of abnormal findings on the image, even in people without lower back pain. Number three, lower back pain tends to get better with time, even without doing anything. The body is amazing at healing. But now you might be thinking, so what? I have back pain, I got an MRI, it says I have a disc bulge, makes sense. I want this fixed. It sounds pretty legit to me, but here's the thing, tons of people without pain also may have the same image. So that just shows lower back pain is not so straightforward. So now that we got all this out of the way, what does it mean? Imaging, usually an MRI for lower back pain, for the most part is unnecessary. So in the real world, why do people get imaging done? Number one, people think that's what they need. People want to figure out what is going on the inside. They want to find it, circle it, and fix it. But in reality, the real reason to get imaging done is if you want to go down the path of getting more invasive treatments like injections and surgeries. So I'll let you in on a little secret. In physical therapy, we don't treat the image, we treat you, the person, not the image. And to be honest, our treatments don't change a whole lot with imaging or without imaging. We focus on function. What that means is we want to get you from where you are now to where you want to be, whatever that is. It could be so that you can pick up a laundry basket off the ground. It could be so that you could go on a hike. It could be returning back to the sport that you love to play. So now you might be thinking, I'm in pain. If imaging is not what I actually need, what do I need to do? So here is where understanding your sensitivities can come in handy. What is a sensitivity, you might ask? It simply means identifying what movements your lower back is sensitive to, aka what triggers your lower back pain. Ultimately, we can't change what is happening on the inside anyway. Number one, load sensitivity. What that means is you're sensitive to loading. It can be any type of load. It could be load from weights, it could be from a backpack, or even just gravity. Whenever you're under some type of load, your lower back pain acts up. That would mean that you're sensitive to load. Number two, your position or your movement preference. So you're sensitive to some type of positions, whether it be bending forwards or backwards or rotating in a certain direction. Say your back hurts every time you bend forward, that would mean your lower back is sensitive to bending forward. And if your lower back pain acts up every time you extend or sit straight up, that would mean you're sensitive to extension. Number three, stasis. What that means is you're sensitive to prolonged positioning. So if you're sitting or standing for a long time and not moving a whole lot, that's when you experience symptoms. Number four, touch. This is more related to the nervous system. For whatever reason, your nervous system is super guarded and super sensitive, so even just like light touch triggers this exaggerated pain response from your body. Number five, nerve tension. This also relates to the nervous system. An example of this would be what people commonly refer to as sciatica. You might have some nervy symptoms down to like on top of lower back pain. So now you might be thinking, what is the point of all this? Simply put, we first have to understand what you're sensitive to before we develop a plan of care and getting you better. For example, if you're sensitive to forward bending, we might have to teach you ways to avoid bending forward temporarily. So something like doing a lunge when you want to pick something up off the ground instead of bending at the back. Maybe change your work setup so you're standing more instead of in this seated forward bent position. So understanding your triggers is the first step of getting better. Then we can incorporate things like strengthening to help get you stronger and feeling better. So keep in mind that you can have a combination of all these sensitivities. So you don't necessarily have to fit in one specific mold. And there's a lot of overlap between all these sensitivities. Be sure to like and subscribe if you found this to be helpful. Comment below if you have any questions. I'll see you next time.